One thing I've learned from studying these big pharma frauds is that they all follow a similar blueprint. After all, their favorite way to make money is to sell more drugs. 2 weeks ago, a federal appeals court decided that the billionaires that own Purdue Pharma, the Sackler family, will be personally protected from civil lawsuits from the people affected by the opioid crisis. In exchange for this immunity, they will pay a $6 billion settlement and lose control of the company. The Sacklers represent the epitome of the American big pharma oligarchy. So let's break down their 5-step business model and dive into exactly how they pull the wool over our eyes. For all the best drug information, I use our software, Polypharm Solutions. Here you can input a side effect and find out the cause, or analyze your drug interactions and contraindications. Use the link in the description to sign up. In order to make billions of dollars in the pharmaceutical industry, you need a drug that everyone uses. Common ailments like depression, anxiety, and pain are a great target because large amounts of people can be easily convinced to take medication. After all, who doesn't get sad or have joint pain? The only issue is that the majority of these generic topics are already quite researched. But if there's one thing that Big Pharma loves doing, it's reinventing the wheel. The Sacklers had already reinvented the wheel once before, when they bought Purdue for their anxiety medication, Valium. Valium was the first drug to surpass 100 million in sales. This is where they mastered their trade because Valium would get put in the hot seat. Its legitimacy was called into question multiple times, but the Sacklers came out unscathed. Making a breakthrough drug is hard. There is only so many compounds and so many receptors you can bind to. The main issue is that unlike in economics, pharmacology is a natural science. You can't change the way you measure a drug's effect like the way they change the measurements of inflation. Well, not exactly. The Sacklers did exactly this with Valium. What was previously a drug prescribed strictly for severe anxiety now became a pill that people popped regularly. They wrote hundreds of articles about a new disease called psychic tension. Basically, a conglomeration of all the mental health disorders, including depression, anxiety, irritation, etc. Sad your dog died? Valium. Stressed about bills? Valium. Instead of making a better drug, make a bigger market. Reinvent the definition of success. Don't treat more people, sell more drugs.
It seems that there are more prescriptions for Valium than there is a justified need. This is based on statistics that I have read. And I wonder if the doctors are aware that they are prescribing Valium as much to a single patient as they are.
It was time to run the same playbook again, and Purdue Pharma developed a drug for end-of-life care called MS-Contin. MS-Contin was based on morphine and was meant to allow cancer patients to get a full night's sleep. Addiction wasn't a large concern, as the primary use of MS-Contin was in end-of-life care. The patent on MS-Contin was running out, and Purdue was looking to change the pain management game the same way that they did with anxiety. They started on a research campaign where they published papers in major journals like the New England Journal of Medicine, saying that the probability of addiction of opiates was previously overstated and that the risk was around 1%. Even though this paper would be later retracted, it received over 600 citations and countless commercials have run on its behalf.
There's no question that our best, strongest pain medicines are the opioids, but these are the same drugs that have a reputation for causing addiction and other terrible things. Now, in fact, the rate of addiction amongst pain patients who are treated by doctors is much less than 1%. They don't wear out, they go on working, they do not have serious medical side effects. And so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
We now have our new compound, we have our phony scientific claims. But the next step is to repurpose our drug for broad appeal. You see, just like Mortimer Sackler knew that selling Valium to patients suffering from anxiety wasn't going to make them millionaires in the 80s, Richard Sackler knew that selling morphine to cancer patients wasn't going to make them billionaires. He knew that the association of morphine and end-of-life care was negative for the mass adoption of MS-Contin. So they developed a new active ingredient called oxycodone. They knew that in order to repurpose it as a general pain medication, they had to prove that it delivered a higher pain-killing ability while being non-addictive. They flooded journals again with research articles about how oxycodone was a weaker form of morphine. The FDA would even approve a statement that said that the delayed release of oxycodone would reduce the probability of abuse. The FDA examiner in charge of this submission would later leave their position at the FDA for a role at Purdue. In 2015, Purdue was granted approval to market oxycodone to children as young as 11. In reality, oxycodone is actually 50% stronger than morphine, and a non-published research paper from Purdue uncovered later showed an addiction rate of 13%. Until now, oxycodone had been mainly used in the same category as MS-Contin, cancer patients. Doctors had really only been using tried and true painkillers like morphine up until now, but Purdue was determined to get their own drug on top. The pharma company started a nationwide campaign of sending their reps out to doctors' offices to convince them to switch their patients from conventional pain meds to oxycodone. The top doctors that were distributing the most meds were identified and taken on luxurious conferences that were more of a golf vacation than anything, and given speaking fees to speak about the revolutionary ability of OxyContin.
Playing football, I had an awesome year. And the game before the playoffs, I tore my knee. I just had a fucking doctor that wanted to give me all these pills. I kept going back to the dude, and he was giving me, whatever. He said these 5s aren't working right. I need something stronger. So he gives me 7.5s and some Dilaudid.
This strategy was wildly successful, and between 1997 and 2002, prescriptions rose from 670,000 to 6.2 million. And 10 years later, prescriptions peaked at 255 million prescriptions. After a while, the slippery slope fallacy became a reality, and money-hungry doctors and sketchy pain clinics were too obvious to ignore any further. In 2010, authorities started cracking down on doctors and supply disappeared. In the meantime, they would also develop the antidote to opiate overdoses and have made billions off of this as well. But once the accusations had piled up beyond a reasonable doubt, it was time to accept reality and do some crisis control. The Sackler family had amassed a net worth larger than $14 billion at this point, and had their wealth distributed throughout art museums and universities, the Sackler Wing in the Louvre, the Sackler Courtyard in Westminster Abbey, and more of the like. In order to avoid being personally liable, the Sacklers embarked on a lengthy legal process, where they bought as much time as possible for the public to move on and for the heat to die down. They had always been very careful to not be personally named in any of the legal proceedings, but as the lawsuits piled up against Purdue, in 2019 they declared bankruptcy, and the lawsuits started piling up for the Sacklers personally.
Do you believe that any of Purdue's conduct has led to an increase in people being addicted in the Commonwealth of Kentucky?
No.
But when you have nearly infinite cash, anything can be arranged. The $6 billion settlement became a cost of doing business, and they are now able to ride off into the sunset. To me, this is the equivalent of catching Pablo Escobar and giving him diplomatic immunity in exchange for 40% of his money. It makes me think about where the money is going and who the real beneficiary of this settlement is. These 5 steps may seem simple, but it takes a ton of ambition, money, and power to pull it all off. Things the Sacklers never lacked. If you like this video, check out this video on the history of Anabar. I think you're really gonna like it. Also drop a like and subscribe for more drug videos.